start with this working session of this morning. Good morning, everybody, and welcome to this first webinar organized by the K-HEALTHinAIR project. This first webinar should be the first one in a series, so expect additional events like this coming in the next future. And this first working session is dedicated to showcase a bit the aim of the K-HEALTHinAIR project, objectives, methodologies, and results that we aim to achieve. The program of today gives me also the possibility to introduce our speakers, starting with me. I am Natalia Allegretti. I'm an innovation projects manager at ECH Alliance, the Global Health Connector, and I will give you a first overview of the K-HEALTHinAIR project. Together with me, I have Leticia Perez, Research, Development and Innovation Consultant and Researcher in Biomedical Science at K-HEALTH. And we have the pleasure to have with us Panayotis Haslaridis, Senior Policy Advisor at the European Federation for Allergy and Airways Diseases Patients Association, EFA. Both ECH Alliance and K-HEALTH are partners of the K-HEALTHinAIR project, so we are very pleased to have as an external support and speakers Panayotis with us this morning. So let's kick off a little bit what K-HEALTHinAIR is about. K-HEALTHinAIR is a project funded by the European Union under the Horizon Europe program. We started our activities back in September 2022, and the project will last in total for 4 years. So we foresee to close the action next August 2026. The project is coordinated by CARTIF, which is a technology center based in Spain and specifically in Valladolid. And we have a number of partners with very different profiles coming from 8 different nationalities. And this is a picture of us, just to show faces behind the screen, gathering face to face during our last meeting that was held in Warsaw in April this year. So let's start a bit with the context behind K-HEALTHinAIR. So indoor air quality. Obviously, the project is about indoor air quality, but what it is the quality of air that is inside buildings. And when we talk about buildings, we talk about homes, schools, hospitals, and how you will see later in the presentation many other structures where we spend most of our time, because generally we spend more than 19% of our time indoors. So that's why the air we breathe is something that really matters for our health and comfort. Why a lot of research exists on specific pollutants and health outcomes, there are still major gaps that needs to be addressed. First of all, although we have numerous data sources coming also from very institutional information sites like WHO guidelines, public health reports, and academic research, there is still a lack of studies that take an holistic approach, connecting pollutants to their sources and the possible impact on human health. Also, there is a very limited real-world analysis on how indoor air pollutants affect health. Most of the existing research are either experimental or quite restricted in scope. And lastly, prevention strategy most often don't take in particular account the problem of the vulnerable populations. And when we talk about vulnerable people, we talk about children or people with chronic diseases, but even the elderly. And this is exactly where K-HEALTHinAIR steps in to try to take a comprehensive real-world look at how indoor air quality affects health, but most importantly, what we can do to improve this. To do so, the project combines several lines of action, starting with a large-scale measurement of both chemicals and biological indoor pollutants in specific selected locations across Europe, as we will see. And these settings really try to represent a typical indoor environment where people live and work. In parallel, we are conducting an in-depth analysis on how these pollutants interact with each other and how they relate to health issues. And this involves advanced theoretical research, as well as clinical studies, laboratory testing, and in vitro and in vivo approaches. Most importantly, K-HEALTHinAIR would like to deliver concrete solutions to this problem, and to do this, this includes cost-effectively, easy-to-apply methods to monitor and improve air quality, as we will see in the results that we aim to achieve. And also the project aims to develop guidelines and recommendations to help implement these improvements in real-world settings. We were talking about real-world settings, and there it comes the pilot sites that are running in the K-HEALTHinAIR project. Those are 5 in total studies across Europe, and each pilot focuses on different environments where people work, lives, or study. Try to give a quite everyday indoor picture of air exposures. As you can see, the pilots are located in very different countries, quite representative countries around Europe. Pilot 1, which is based in Spain, looks at indoor air quality in hospital, market, and the metro station. Obviously, those are very busy public environments with a lot of foot traffic. The pilot number 2 is based in the Netherlands, and it focuses on hospital and retirement home, where residents are quite often more vulnerable to poor air quality. Norway monitors students' canteens and students' residencies, and this gives us a glance of spaces that really represent young and an active population. In Germany, the study includes workers' canteen and lectures hall, reflecting professional but also educational settings. And finally, in Poland and Austria, the studies focus on homes and schools, most of them 2 important places for long-term exposure, specifically for children in the specific case. Altogether, this 9 monitoring scenario covers a quite diverse range of environments and demographic groups, and this allows the project to understand how indoor air quality varies across settings and population, and we will try to tailor solutions accordingly each specific needs. Let's have a look at the methodology implemented in K-HEALTHinAIR. The methodology has been designed, let's say, in 2 main phases, combining real-world data collection with scientific analysis to better understand how indoor air quality affects our health and what we can do about it. The first phase, which lasted for 6 months, has been a sort of preparation phase. First of all, we have been reviewing previous research and setting up tailoring monitoring plans for each of the pilot site scenario. And this groundwork was aimed to really help us fine-tune our approach and get ready for long-term collection. And obviously, we have been dedicating our time in recruiting participants and establishing the environment, including, as we have seen before, schools, hospitals, but many other public and private, let's say, environment. The core of the project is really the study, so a 3-year study project, and each of the year has been dedicated to specific activities. We started in year 1 with determinants, where we were looking at what everyday factors like our habits or even building conditions can affect indoor air quality. The second year has been dedicated to sources, where we traced, let's say, where pollutants were coming from, whether from inside, outside, which was the correlation between outside indoor air quality and the one that we breathe inside our building, and they can interact with people and the environment overall. The third and last year of the project will be dedicated to measurements, and we will test what works to reduce pollution and improve the health outcomes. Each year follows a cycle of data collection and analysis, so that we try to always learning and improve as we go on, and we reset every time we see that additional gaps needs to be addressed. Throughout the study, we are also building a predicting algorithms using sensor health data that will help us to estimate exposure level, assess health risk, and develop personalized recommendations for both individuals and public health decision makers. In short, this methodology has been really aimed to move from data, so from theoretical gathering of data and analysis to solutions, but based with a strong scientific foundations. In terms of work plan, we follow a clear structure that started with collecting the data, moves into the analysis, and ends with real-world applications relevant for the society, the scientific community. So, as we have seen, we are running 5 pilot studies in different European countries where we monitor indoor air pollutants like VOx, particulate matter, radon, but even indoor microbiome. The data is collected in the different settings that we have seen using sensors, but also questionnaires. And we are also following more than 300 patients with chronic respiratory issues using portable devices and health records. On top of that, we bring in also public health and environmental data from external sources to have a much more concrete and complete pictures. Secondly, and here we come to the center of the image showcase right now, there is the data analysis. So once the data are gathered, we use advanced algorithm to look for partners and find the most relevant links between air quality and its impact on health conditions. And then our team of experts reviews the results to identify which pollutant matter most and how people is being really exposed to them. The insight that we have gained and that we continue to gain during the next year are turned into practical solutions, and we are helping developing smarter sensors and purification technologies based on scientific evidence, so based on actual health risks. And we are also building, and we have built already, and we are inputting with the content and knowledge, an open platform to share all the information and knowledge produced by this project with policymakers, researchers, and the industry. And ultimately, our goal is to support better policies, trainings, and tools to make indoor spaces healthier for everybody. In terms of results, some of them have been already mentioned during the presentation, but obviously K-HEALTHinAIR aims to deliver a wide range of impactful outcomes, including, as I said before, new sensor technologies for detecting specific microorganisms like Aspergillus, improved monitoring tools and method to measure indoor air pollutants more effectively, collect real-life data sets from diverse ranging across Europe, advanced data analysis modeling using AI, but also big data to link IAQ to health effects, clinical and public health insights from studies involving vulnerable groups, clear identification of health-relevant pollutants and their sources, innovative air purification systems also featuring advanced technologies like the photocatalytic oxidation, and practical guidelines tailored to different environments to really try to improve indoor air quality and health overall. As we said, we have been developing this open access platform for sharing data and insights with researchers, professionals, and the public, and the platform is freely accessible through the project website. And by the end of the project, we aim to develop a number of policy recommendations to support new air quality regulations, but also educational tools and training materials from a wide range of stakeholders, from public authorities to healthcare professionals, but even for the society as a whole. And with this first glance, let's say, of the project aims and objectives, we stop sharing and leave the floor to Letizia, that will give us some more insights about the foundations of research about indoor air quality. Letizia, please.
Okay, so thank you, Natalia. Good morning, and I am Leticia Perez. I work at K-HEALTHinAIR as a researcher and European projects consultant, and as my colleague Natalia has already mentioned, I am involved in the K-HEALTHinAIR project. In this sense, our role in the project, the role of K-HEALTHinAIR in the project is on the one hand, leading the work package 4, which is focused on knowledge sharing and training. And we specifically are in charge of the task related to social engagement and educational and awareness actions. And on the other hand, we are also the exploitation managers of the project results. So this is the reason why I'm here today, and my talk will be an overview of indoor air quality fundamentals. So, well, first of all, I would like to start with a reflection. So we breathe around 20,000 times a day, but did you know that indoor air quality can be up to 5 times more polluted than outdoor air? Well, right now, most of you are sitting in the office or at home attending this webinar, and you could be breathing an invisible cocktail of 100 different chemicals. Now, with this impacting data in mind, I would like to talk about indoor air quality. So, well, when we hear the term air pollution, we usually associate it with a risk that we face outdoors. However, as I anticipated, the air we breathe indoors can be contaminated as well. In this sense, research studies suggest that indoor air pollutant concentrations are increasing, driven by different factors such as the use of chemical substances in household products, inadequate ventilation, warmer temperatures, and increased humidity, among others. So these factors affect air quality and consequently our health. Since, as Natalia mentioned before, we spend the 90% of our lives indoors. So, well, indoor air quality refers to the quality of air in and around buildings and structures, especially as it relates, to the health and comfort of building occupants. In other words, the quality of indoor air dictates how pollutants, temperature, humidity, and other environmental elements influence the health and well-being of individuals who spend time in a closed space. Okay, which are the sources and determinants of indoor air quality? Well, among the pollutants that contribute to poor indoor air quality are included those which penetrate from outdoors and sources that are specific to the indoor environment. Most of these sources can be grouped in human activities indoors, such as smoking, burning solid fuels, cooking, or cleaning, vapors from building materials, equipment, and furnishing, and biological contaminants such as mold, viruses, or allergens. Well, in general, the most common indoor pollutants include carbon dioxide from human respiration and combustion, volatile organic compounds from furniture and cleaning products, particulate matter from cooking and outdoor infiltration, radon seeping from soil and building materials, carbon monoxide, and biological contaminants. Well, in the KIA project, last year, we conducted a systematic review where we analyzed the sources and determinants of these pollutants across different European environments. You can see the scenarios selected in the table, and these scenarios are the same that are included in the project. We have schools, homes, lecture halls, hospitals, retirement homes, public transport, and canteens. Well, we found important differences regarding indoor air pollutants across all of these environments, being influenced by daily activities, building design, ventilation systems, and outdoor pollution. These are the reasons why the main pollution sources and the main pollutants were really different for the specific scenarios reviewed. Okay, when the indoor air quality is inadequate due to the presence of common pollutants, significant effects on human health can occur. In the following slides, we are going to go deeper in these issues. So some health effects, such as the irritation of eyes, nose, and throat, headache, fatigue, or dizziness, can appear shortly after a single exposure or repeated exposures to a single pollutant. These symptoms may become more severe and worsen, leading to more serious symptoms, such as, for example, asthma. Well, the likelihood of these immediate reactions to indoor air pollutants depends on different factors. For example, age, pre-existing diseases, and even individual sensitivity. So they can vary considerably from one person to another. However, this is not only immediate effects that result from exposure to indoor air pollutants. There are other health effects that might appear even several years after exposure has occurred and or only after long or repeated periods of exposure. Here we have respiratory and cardiovascular diseases, cognitive effects, or even cancer. Furthermore, to add additional complexity to the issue, the health effects of indoor air quality can be also subdivided into acute effects, suffered mainly by people with previous health problems, and also chronic effects, which can affect everyone according to their specific conditions, population group, level of exposure, etc. So, well, at this point, it is really clear that indoor air quality is an important determinant of human health with significant implications for vulnerable persons and patients. While indoor environments are often perceived as safe shelters from outdoor pollutants, they can harbor a multitude of contaminants that pose health risks, particularly to individuals with pre-existing health conditions or compromised immune systems. So, understanding the impact of indoor air quality on vulnerable groups is essential, is crucial for developing effective strategies to mitigate risk and promote healthier indoor environments. Well, within these vulnerable groups, we have the following ones. So children, older people, pregnant women, individuals with chronic respiratory conditions, with weakened immune systems, and also individuals with cardiovascular diseases or other underlying health issues are included. For these groups, the exposure to indoor air pollutants can exacerbate existing health conditions, trigger allergic reactions, and increase the risk of respiratory infections, for example. Yeah, it's important to note that among these vulnerable groups, patients in healthcare settings represent a particularly at-risk group. Yes, okay. So hospitals and healthcare facilities are unique environments with specific indoor air quality challenges, including the presence of airborne pathogens, the exposure to medical gases and volatile chemicals, and also the potential for nosocomial infections. Moreover, these patients have a compromised immune system, so they are especially vulnerable to indoor air quality related health risk. For these patients, poor indoor air quality in these healthcare settings can prolong hospital stays, for example, or increase the risk of postoperative complications, and even contribute to spread infections. Okay, the impact of indoor air quality on vulnerable persons and patients is multifaceted and can manifest in different ways. First, respiratory health is particularly susceptible to the effects of indoor air pollutants, with studies linking exposure to indoor pollutants to increase asthma symptoms, respiratory infections, and exacerbations of chronic obstructive pulmonary disease. Additionally, poor indoor air quality has been associated with cardiovascular effects, including increased risk of heart attack, strokes, and hypertension, particularly among individuals with pre-existing cardiovascular conditions. Furthermore, indoor air quality can influence cognitive function and mental well-being, and studies here suggest a link between indoor air pollutants and impaired cognitive performance, increased stress level, or decreased productivity. Finally, for vulnerable boom groups, such as, for example, children or other people who spend a really significant amount of time indoors, the quality of indoor air can have profound implications for their overall health and quality of life. So, addressing this indoor air quality related health risk among vulnerable population requires a multidisciplinary approach that combines preventive measures but also interventive strategies. So, regarding measures to control and maintain indoor air quality, specific actions can be undertaken. We have here these pictures of monitoring, source control, ventilation, disinfection, and filtration. Monitoring provides real-time assessment of air conditions through sensors that track pollutants and environmental parameters. Source control, which is the most cost-effective approach, eliminates contaminants and at their origin by using low-emission materials and maintaining the equipment properly. Ventilation ensures adequate air exchange through natural or mechanical system. Filtration removes airborne particles and gases, and finally, disinfection targets pathogenic microorganisms through UV light, ionization, or other antimicrobial technologies. So these are the 5 fundamental cornerstones of indoor air quality, and the combination of these precautions measures is the most effective way to minimize the risk of poor indoor air quality related diseases. Okay, apart from the action that we can individually take as citizens, the pivotal approach to mitigate health risk associated with this inadequate indoor air quality lies, of course, in our knowledge and management of prevalent indoor pollutants. Although much progress has been made in understanding what are the most common pollutants in indoor air and their effects in health, the current studies are mainly focused on specific parameters or specific scenarios, mainly related to the well-being, safety, and health of people in their workplaces. So we need more research. First, focusing aspects such as the synergistic effects among different pollutants or the effects of new contaminants arising from newly developed materials, for example. We need more research to understand how much and how long people need to be exposed to indoor air pollutants to cause specific health problems. And finally, of course, for more research for developing using user-friendly monitoring tools. Okay, and we have talked about the need for further research, but what about the need for regulation? Well, all of you know that implementing policies and measures to improve air quality not only promises better health outcomes and a healthier environment, but also reduce the healthcare costs. What is happening? Well, it is true that governments are increasingly adopting policies on air quality, but they are mainly focused outdoors. So while this outdoor air quality is monitored and regulated, that's not the case of the quality of air in indoor places. Surprisingly, the definition of healthy indoor air quality remains a bit ambiguous, and state governments often lack a comprehensive regulation to address and manage indoor air quality. So now, well, it is clear that the significance of indoor air quality is underestimated. Despite, as we have mentioned several times, that we spend 90% of our life indoors, despite it being one of the top 5 significant public health risks, And despite research studies suggest that indoor air pollutant concentrations are really increasing. So the need for focus also on policies to improve air quality is becoming increasingly evident. Okay, so just to finish, I would like to remind some key messages to take away. The first one is the shelter paradox. So the spaces we seek protection, our homes, offices, schools, or other workplaces, can be up to 5 times more polluted than outdoor air. So it is really important to make monitoring indoor air quality a natural habit. Well, second, we have seen the wide variety of health effects of poor indoor air quality. So it is a high, silent health hazard that affects from daily productivity to the development of chronic diseases. So in this sense, it is important to apply the recommendations mentioned before. Then universal vulnerability with differential impact. Yeah, we have seen that, well, we know that all of us breathe the same contaminated indoor air, but people with pre-existing conditions suffer a double impact: immediate acute effects and the acceleration of their chronic pathology. So in this sense, knowing the specific pollutants in your most frequented spaces could serve a prevention strategy. And finally, while outdoor air is highly regulated, indoor air remains largely uncontrolled. Since regulatory bodies are in charge of that, what we can do is help to increase awareness on the importance of indoor air quality among our close people. And just to finish and just to think about it, in the next 24 hours, we are going to take approximately 20,000 breaths. So the question is not whether you are going to breathe, but what are going to breathe. And yeah, that's all. So thank you very much. And now the floor is to Panagiotis.
My name is Panagiotis Heslaridis. I'm senior policy advisor at the European Federation of Allergy and Airways Diseases Patients Associations. And yeah, I was invited to discuss about the impact of indoor air pollution on respiratory health in particular, bringing the perspective of patients living with allergy, asthma, and chronic obstructive pulmonary disease. First of all, a few words about IFA, my organization. It's a patient organization, umbrella style organization based in Brussels, representing more than 200 million people living with allergy, atopic eczema, asthma, and chronic obstructive pulmonary disease in Europe. We work along four main programs, so pillars of work, including community, prevent, health, and climate change. Of course, indoor air quality falls under mainly prevent, but you can imagine that it is more or less cross-cutting to all other programs. We are a members-based organization with 48 members, national associations in 28 European countries, including EU member states and non-EU member states. Yeah, so a few introductory words about indoor air quality and health, the strong links between those two. It's being increasingly acknowledged as a key health determinant, the quality of air that we breathe indoors. According to data responsible for about 10% of non-communicable diseases at a global scale, and the loss of about 86 million healthy life years with data from 2019. And actually, approximately 10 to 15% of new cases of childhood asthma and 3% of COPD deaths in Europe, which means that exposure to indoor air pollution not only exacerbates existing diseases, but also contributes to their onset. So short and long-term health impact, especially for people with pre-existing conditions, respiratory conditions, for example, but also for the whole the healthy population. Coughing, wheezing, as it has been mentioned already, irritation in the eyes and the throat, fatigue, and so on. Of course, the development of chronic and life-threatening diseases, including asthma and chronic obstructive pulmonary disease, but of course, the worsening of existing conditions, leading often to hospitalizations and even visits to the emergency room. As it was mentioned already, there are several sources and pollutants of indoor air pollution. No need perhaps to go through them in much detail. Two main categories, biological and chemical. Pollutants, biological, for example, include the allergens, the dampness, the mold. Chemical pollutants include those emitted from cleaning and cosmetic products, such as detergents and fragrances used on a daily basis. Emissions from the burning of solid fuels and from cooking, emissions from construction materials, furnishings, material that we use or are used for the building the furniture, and of course tobacco smoke. And of course a huge interlink with the outdoor conditions and including those driven by climate change. So the increasing temperature, the levels of humidity, the levels of ambient pollution, and of course pollen that might be generated outdoors but can easily enter into our buildings. And of course, there's a big inequality dimension of indoor air quality from the perspective of generation, but also acceleration of health, both health and socioeconomic inequalities. Why health? Because, of course, as mentioned, the impact is disproportionate for vulnerable populations, such as those with pre-existing conditions, but also such as children, as it was mentioned by Leticia. And why, in particular, children are vulnerable? Because, of course, they breathe faster than average adult, and of course, this way they take in more pollutants because their airways are smaller. Because their lung and immune system are still under development, and because they spend most of the time indoors, including at home and in the school environment. And of course, a huge driver, indoor air pollution is a big driver also of socioeconomic inequalities, as it is often the case that medium and low income households have limited access to clean technologies for heating and cooking, for example, and limited resources to perform clean renovations in their households. Now, as it was indeed alluded before, these are all factors that contribute to complications in our complete understanding of the impact of indoor air quality and health. And by this, I mean the multiple sources that were mentioned and the pollutants that are involved. The fact that many human activities are happening that produce pollutants are happening at the same time. The interplay and the links between outdoor and indoor, but also the important role of insulation and ventilation systems in managing and regulating indoor air pollution levels. Now, a few words about the current status of policies related to indoor air quality in the European Union. As IFA, our main, let's say, scope, the EU institutions and the EU policies, while, of course, we are active at the global level or even the WHO regional Europe level on many of those issues. Yeah, as mentioned before, for many years, indoor air quality remained a kind of secondary issue on the margins of the policy and political debates at the EU level, and largely unregulated at the EU level, while by comparison, ambient air quality issues and standards have been placed at the top of the priorities from an EU perspective. However, there is indeed an emerging discussion in the last in the recent years, even if at a very slow pace. In 2021, there was a kind of breakthrough with the EU Zero Pollution action plan, part of the Green Deal of the EU at that time, where the Commission virtually acknowledged the role of indoor air quality on health, dedicating a wholly distinct, let's say, section of the action plan into indoor air quality and committing to assess pathways and policy options to improve indoor air quality, focusing on key determinants and pollution sources and exploring ways to raise awareness and reduce risks. This has been, again, the first time that we see this formal acknowledgement and recognition of indoor air quality as a policy field where action should be taken. And of course, on many occasions, we have received the acknowledgement by the Commission, the EU executive, that indeed issues on indoor air quality are quite fragmented still, because they refer to so many cross-cutting policy fields and policy domains, but still that there is a necessity to take action. Now, a few words about what IFA is doing, advocating for better indoor air quality. We are part of a cluster of projects, ideal cluster of projects, working on exploring the links between indoor air quality and health. We are a part of the synergy projects within this cluster, and we are, of course, happy to also collaborate with K-HEALTHinAIR in this, in the context of the cluster. As synergy, we do have the objective of identifying, and that also connects from my point earlier, to identify and quantify the synergistic effects between different pollutants affecting health. So not individual pollutants, but the combined exposure. The focus is on the school setting. The scope is on chemicals, chemical and biological pollutants, including allergens and microbes. Yeah, we explore and monitor, Synergy explores and monitors the situation in schools in 5 European countries, Finland, France, Georgia, Greece, and the UK, and leads, among others, together with K-HEALTHinAIR, the cluster, the work of the whole cluster on the translation of science into policy and practice. Yeah, and one of the key work streams where IFA is involved is the development of policy briefs, looking into different aspects of indoor air quality and health, and addressed primarily to policymakers. The first one was published in October 2024. There are 2 more coming up. One of them is actually in preparation with publication due for January 2026. And part of our work in this second policy brief relates to will highlight best practices on indoor air quality, and this is why we have launched a survey for every stakeholder that is interested to highlight, to discuss, and to bring forward best practices at the national, regional, or even local level, upon which we can refer to in the second policy brief in support of our arguments. And I'm glad to put the link of the survey in the chat later on. So what concretely is it that we are advocating for from the perspective of patients living with allergy, asthma, and COPD on several occasions? For example, in the EU renovation wave that was presented a few years back, and the subsequent revision of the performance of buildings directive, energy performance of buildings directive, we have been advocating for energy performance certificates that are informing residents about indoor air quality and health-related financial tools for renovations at the EU level. We were also active on the revision of the construction products regulation, inserting the health perspective in a very much market-oriented legislation. And of course, we have been proposing for work around for advancement of work around ventilation, because we see it as a key to minimize exposure to harmful pollutants. For example, by establishing a clear legal definition of ventilation that relates to indoor air quality, which is not still the case, and information regarding ventilation rates in the most common space categories. Finally, we're also active at the in the work of HERA, a relatively new agency of the European Union. They have a joint work with the Joint Research Center looking into technologies for decontaminated indoor spaces. And I think that's where I come to an end, and happy to receive any question. Thank you very much.
Thank you so much, Panayotis. This has been really interesting, and thank you also for mentioning the ideal cluster, which really gathers this number of projects together, working on the same topics with different perspectives, more or less. So, dear audience, the floor is yours now. I see some questions already coming. If you want to post your questions, please use the questions and answers facility that you have at the top bar. But maybe we can start with the questions that I have already received. Panayotis, I think the first one is for you and relates to how affected community, like IFA patients, can be better integrated into indoor air quality decisions making at EU and national level. So how much the voice of affected population can be really listened and implemented in policy making.
Yeah, thanks a lot. This is interesting because this can happen at many levels, at the national and regional level, but at the EU level, I mean, the prescription we would give to authorities is to always listen to those communities and try to involve them in the discussions. There are different platforms and initiatives at the national level that are taking place that include all types of stakeholders, from scientists to citizens, and also at the EU level, initiatives that are really bringing stakeholders together in support of the policies that that yeah, are being discussed. And of course, in the context of projects like the ones that we have mentioned and the ones that we are members of, it's important that communities are heard, because these are the people that are directly affected and are, let's say, the end users of the spaces that we breathe in. So we do ask the authorities to take indoor air quality seriously, and strengthen awareness. So these communities are also very useful through their networks and channels to spread awareness across the broader public. And I think that it is a win-win situation when communities like IFA, but also other patient organizations from other disease areas are being again engaged actively and proactively by the authorities also from that perspective.
Thank you very much. And let's hope that also the work that we are doing in preparing policy briefs, etc., really can support a more informed, let's say, decision making
absolutely.
on these topics. I have another question for Panagiotis for you. Talking about implementing technologies to help decontaminating spaces, are there any specific technologies already in discussions, or what technology are being implemented?
Well, there are several technologies that exist already. Of course, there's always the issue of access to this technology and how accessible and affordable they are. And also there is technologies being advanced for monitoring and also decontaminating. In the context of projects that we are part of, I think that it's a matter of standardizing those technologies and being able to commercialize them at a grand scale, but also assess them from a purely health perspective to ensure that indeed there is a good health outcome for people using them, but also they are accessible. Indeed, everyone can have them.
So it's not just a matter of developing; it's a matter of adoption and
There are
accessibility.
several stages, indeed. Yes.
Letizia, I have a couple of questions for you. The first one relates to this systematic review that you were mentioning, and that relates to the K-HEALTHinAIR project. What specific factors were identified that contribute to variations in the main pollutants and pollution sources across the different scenarios? Now talking about real-world data, really, and real-world scenarios.
Okay, thank you, Natalia. Yeah, we conducted this systematic review the last year, and I think most of the partners of the project participated. The main determinant was ventilation, but also the number of occupants within the indoor buildings or the indoor scenarios was an important factor, as well as the specific activities of the different scenarios. For example, for homes, cookings and also disinfections in the hospitals. And other key determinants were also the building characteristics, such as the age or the construction materials, seasonal variations, and also some geographical factors. And I think these were the most important key determinants that we review. Yeah.
Thank you. And again, for you, at the beginning of your presentation, you mentioned that you're leading a work package which focuses on knowledge sharing, training, and awareness creation. Can you elaborate on the specific activities and initiative you implement within this work package? And maybe we can also do a reference to our project website where most of these outcome are gathered, no, Letizia?
Sure. Yeah. So thank you very much, Natalia. Yeah, as I mentioned before, we are the leaders of the Work Package 4, and here we are in charge of the task 4.4, which is more related with social engagement actions, and the second one is related to the development of training materials. No, so for the social engagement, we first perform an ecosystem analysis. So here, together in collaboration, together with EC Alliance and the Work Package 5, which is the communication and dissemination ones, we develop this stakeholders mapping, and then we also seek citizen engagement infrastructures at the local levels for each pilot. Then the second phase was the diagnosis. And in this case, we perform a SWOT matrix just to detect the strengths, weaknesses, opportunities, and threats related to social engagement in its scenarios of the project, and the impact mapping just to explore which is the specific impact that the project could have at scenario level. And from all of these phases, we develop the action plan, and but just to share with the audience, here we develop different activities such as role-playing activities, different consultations, for example, regarding the open access platform, as Natalia mentioned before. We develop also brief versions of our deliverables that we think they could be really interesting to share with the stakeholders. And since we have the knowledge sharing module in our web page, we can share all of these materials with the different profiles of the quadruple helix, as Natalia mentioned at the beginning of the project. And regarding our training materials task, at the beginning of the project, we carry out a survey on need formations just to develop materials in a more personalized way. I mean, regarding or based on the specific need and interest of the pilots. And regarding these materials, we have the knowledge pills, infographics, these webinars, ventilation recommendation. I mean, all kind of materials that the pilots need, and at the end are really interesting to share with the stakeholders through the website, and specifically through the knowledge sharing module.
Thank you, Letizia. Thank you so much for being with us, and thank you to my speakers, Panagiotis, first of all, Letizia, Dimitris, for all the organization behind the screen, and to the audience, stay tuned for additional events like this.